Does the inside of your knee feel stiff, achy, or throbbing whenever you stand up or go for a run? Well, the problem isn't coming from the inside of your knee. It's coming from 3 different muscles that are actually affecting how your knee moves. And this is putting stress on your knee that you don't want. In this video, I'm going to show you ways to help loosen up those tight areas. And then 2 exercises that you cannot skip if you want your knees to stay strong and mobile. If you're new to the channel, I'm Dr. Erik Simms, aka the Kentucky Chiro. I've been seeing patients for over 20 years and performed over 100,000 adjustments. So, why are we having pain on the inside of your knee? Whenever you have pain on the inside of your knee that's coming in this area right here, it's most likely coming from the fact that your IT band and your Plantaris and Popliteus muscles are not functioning like they should. What I mean by that is those 3 muscles work with your knee on how it bends. And the issue is that if your IT band gets tight and your Vastus lateralis gets tight, then that area is going to actually attach to the side of your kneecap, and it's going to pull your kneecap this way. Now, if you're going on your left knee, it'll be pulling it this way. But what happens is when the kneecap is pulled laterally, then the joint, instead of actually flexing like this, will actually start to flex like this. And so what happens then is when that knee starts flexing, because the kneecap is pulled to the side, it starts to grind on this area right through here. That starts to cause inflammation, and that rubbing over time will continue to wear down the cartilage and the tissue, and then it's going to start to cause more and more pain, and eventually it'll put pressure on the bone. The bone will beef up to deal with that pressure, and that will start to cause arthritis. You might be wondering, well, why is my knee pulling like this in the first place? Well, it's really quite simple. You see, for most people, if we're sitting all day or if we're walking all day, we tend to do everything one plane of motion. That means we're going just like this. The issue is that if we're just walking in those planes of motion, that's going to be hitting more of the Vastus lateralis, which is the muscle that comes right here on this side of your leg, more the lateral side. The muscle that helps keep the kneecap in place and not go out to the side is called your vastus medialis. And that's this muscle right here. It kind of looks like a teardrop when it's developed real well. The issue is if this muscle is getting overworked and this muscle is not getting worked enough, this muscle will start to get weak and tight and start to pull to the side. That also can adhere to the IT band, and that means this whole area becomes tight, and you will get scar tissue that forms between the fascia and the muscle. And as that tightens up and starts to pull the kneecap laterally, this muscle gets weak, it doesn't pull that kneecap back. The other issue is that when the kneecap starts going to the side, you have 2 muscles on the back of your knee. One's called the Popliteus, which crosses right here. The other one is called the Plantaris. That muscle actually goes from here down to your ankle. And what those 2 muscles do is they coordinate how much that knee should bend. The Plantaris gets information from the calcaneus, or your heel, and it attaches right here up behind the knee, and it crosses a nerve. And that gives information to tell your brain, hey, this is where the ankle's at, this is how much the knee needs to bend. And when those 2 muscles get really tight, then what happens is you start to put more pressure on the outside of your knee, and we start walking a little bit more on the outside of the foot. To actually correct this, what we need to do is we need to loosen the Popliteus, the Plantaris muscles behind the knee, and we need to loosen this muscle right here, the Vastus lateralis and the IT band. The other thing we need to do is we need to try and strengthen this muscle right here, the Vastus medialis. So the first thing we're going to do is we want to loosen the Plantaris and the Popliteus. How do we fix this? Well, the first thing we're going to do is we're going to do a little bit of massage, kind of relieve some of the tightness that's in the muscles. What we're going to do is we're going to put our hands behind our knee, okay? And you're going to go above the calf, but below the hamstring. You kind of feel a little bit of a pocket of tissue, okay? If it's a little bit squishy, that's okay. That's understandable. Might be a little inflammation there. But you're going to kind of feel around, and you'll feel a muscle that kind of goes across from the outside or the lateral aspect of your knee to the inside of your knee, or the medial part here. And what you're going to do is you're going to take both thumbs just like this. You're going to push right here behind that knee, and you're going to extend your leg just like that. You're going to kind of push and go, push and go. Now, this might be hard to do by yourself, so it might be good to actually get a partner to do it for you. Have you actually lay on your stomach, and the person will push in those areas, and you'll just take your knee from a bent position and straighten it out. But if you don't have a partner, then I suggest either taking your thumbs, or for me, I use my fingers here. We take it just like this. I go above my calf, I push in, and I pull up like I'm pulling towards my head. And I take the knee and I extend it out. Pull up, extend it out. Pull up, extend it out. You're going to do that going across the back of the knee. So you'll start on the outside and work your way to the middle. So you go here, just like this, across, here, across, here, come across. Does this feel uncomfortable? Yes, it usually does. And if you're having knee pain, this can be really, really sore. So you want to make sure that you're not using too much pressure. You're not trying to bruise yourself, but you're just going to be pushing in and up, and then you're going to be working your knee back and forth like that, okay? As you do this, you'll do it about 10 to 15 times going across the knee. So you'll do basically 1, 1, 1, 2, 2, 2. Okay. If that area doesn't, or you don't feel like you're getting it working well enough, then the easier thing you can do is kind of put your knee right here. You'll take it, you'll bring it up, and you just kind of work behind the knee, just going like this, right in here. And you'll feel some tight tissue, and you'll just work that knee back and forth. And what you'll do, you'll push up, down, okay? What I mean by that is you're pushing towards this way and then down this way. So up, down, going across a little bit back and forth. Like I said, this is a little hard to do by yourself, but you might find some really sore areas, and you're just going to kind of massage on those for a little bit. Another thing you can do is you can actually use your hypervolt, or if you've got another percussor gun just like this, you turn it on, and what you're going to do is you're going to just go behind the knee, just across in circles, just like that. This might be a little easier, but it's usually not as effective, but it can help a little bit. The next thing we're going to do is we're going to work on the IT band and the Vastus lateralis. One of the best things that you can do is you can get a foam roller, okay? And you want to make sure that the foam roller is not super hard. You want to be able to squeeze that foam just a little bit, because if it's too hard and really hard to squeeze, it might be too painful to roll on that area. But what you're going to do, come just like this, right here on the side of that IT band, and you're just going to go back and forth just like this. As you work this area right here, that vastus medialis and that IT band both, you'll probably feel an area that is about 1 hand length from your knee. So you go from the side of your knee, and it's going to be about right there. You're going to feel tightness and an adhesion. That's normally where that adhesion occurs between the IT band and between the vastus lateralis. You'll take that and you'll go back and forth just like this right here. Again, you can use the vibrocussor just like this, and you turn it on and you'll go up and down right there. And you might hit those areas. Like I said, it's about a hand length coming like this. It's right here, side of your leg right there, and you'll hit that. Now, if you have a longer leg, I tend to have pretty short legs, but I do feel that using the foam roller is a little better. Now, something that works even better to actually massage this area is actually getting a broom handle or a dowel rod just like this, and you take it, you sit, and you just kind of work it like you're working pie dough right here. This works real well when you're doing it with someone else, a little bit hard on yourself. And that's why I recommend the foam roller first. But if you've got somebody that can help you, have them take the dowel rod and rub up and down the side of your leg. This can be very, very painful. So be very careful with whoever's doing it with you. And if they're mad at you, don't let them do it. You know, many of our aches and pains can be relieved just by loosening our muscles. So if you'd like a free 10-minute at-home stretch guide to just keep you loose and feeling good every day, click on that link in our description below. We have 2 exercises that are very effective for actually helping with knee pain. And the first one is actually going to be walking backwards. I know it sounds counterintuitive, but the thing is, when you actually walk backwards, you actually activate your posterior chain. By activating your posterior chain, you're actually going to cause the muscles to fire in a different way, and that helps to strengthen them. So what you can do is, if you have a treadmill at home, you can walk backwards for half a mile. If you don't have a treadmill at home and you have to do it outside, then go around your neighborhood and just walking backwards, always looking behind you. But the reason we do it is because as you step backwards like this, it does cause us to function in a different way, and so that our feet land and our knee is getting worked. Plus, it works that vastus medialis a little bit better as well. So I would do either a half mile, but start off with like 100 to 200 yards walking backwards. And if you have a little bit of an elevation, or if you have a treadmill, you can actually raise that elevation. I would raise it to a 1 or a 2 so that you get a little bit of elevation, because that is even more effective in actually helping the knee to get stronger. The next exercise we're going to do is actually using a band to put around your legs. So you take it like this, put it around the 1, step around here. You're going to put that just right here, keeping your legs apart. What this does is this causes you to move in a lateral motion. Now, you think that would be counterintuitive to strengthening the vastus lateralis, but it's not, because the thing is when you step and then close, step, close, and you do that, about 10 times going each direction. That works your knee in a different plane of motion. So you're stepping, close, stepping, close, stepping, close. And you'll do that about 10 times each direction, and you'll do about 3 to 5 sets of that. What you want to work up to is doing it about 20 times in each direction. So 20 times this way, then 20 times back that way, and doing 5 sets. And that will help to strengthen the knee by working in that different plane of motion. And it also helps to develop a little bit more of your butt muscles here. And it works the TFL, which goes into the IT band, and helps to work it and loosen it a little bit more. For more exercises and tips to feel your best, click on the subscribe button. And if you'd like to set up a free consultation with Triple Crown Chiropractic, then click on the link in the description below. I'm Dr. Erik, aka the Kentucky Chiro, and I'll talk to you soon.